Welcome to your ServSafe certification journey. This comprehensive lesson will equip you with essential knowledge about the ServSafe program, its importance in the food service industry, and what you need to know to pass your certification exam. Understanding the foundation of ServSafe is crucial for your success throughout the course and in your food service career. Let's get started with understanding ServSafe and its purpose. The ServSafe Program Overview. ServSafe is the premier food safety training and certification program administered by the National Restaurant Association. It represents the gold standard in food safety education, recognized by more jurisdictions than any other food safety certification program. Key facts for your exam. Developed by the National Restaurant Association. Based on the FDA Food Code. Updated every 5 years to reflect current food safety science. Valid for 5 years upon successful completion. Accepted in all 50 states. Why ServSafe matters. The program exists to protect public health by ensuring food service professionals understand and implement proper food safety practices. Each year, approximately 48 million Americans get sick from foodborne illnesses, resulting in 128,000 hospitalizations and 3,000 deaths. Critical statistics to remember. 1 in 6 Americans get foodborne illnesses annually. Foodborne illness costs the industry billions in lost revenue. Proper food safety training can prevent most foodborne illness outbreaks. Let's explore the different types of ServSafe certifications. Food Protection Manager Certification. This is the most comprehensive certification and what most people refer to when they say ServSafe Certified. Exam details. 90 multiple-choice questions, 2-hour time limit, passing score 75% or higher, must answer at least 60 questions correctly, covers all aspects of food safety management. Food Handler Certification, a basic level certification for entry-level food service workers. Key differences: shorter exam, like 40 questions, 90-minute time limit, passing score 75%, covers fundamental food safety practices, valid for 2 to 3 years depending on jurisdiction. Specialty certifications. ServSafe also offers specialized certifications: alcohol, responsible alcohol service; allergens, managing food allergies in food service; workplace, general workplace safety. In this part of the course, we're focusing on a critical topic of legal requirements and regulations. Federal versus local requirements. Federal level. FDA Food Code serves as the model. Updated every 4 years. Provides science-based guidance. Not federally mandated, but widely adopted. State and local level. Each state adopts its own version of the food code. Requirements vary by jurisdiction. Some areas require certified managers on site at all times. Penalties for non-compliance range from fines to closure. Manager certification requirements. Common requirements to know. At least 1 certified food protection manager per establishment. Manager must be present during all hours of operation, or varies by state. Certification must be current and from an approved program. Recertification required every 5 years. In this section, we're going to focus on the 5 key risk factors. The CDC identifies 5 major risk factors responsible for foodborne illness. These are heavily tested on the exam. Purchasing food from unsafe sources. Must buy from approved, reputable suppliers. Suppliers must meet federal or local laws. Home-prepared foods are never acceptable. Failing to cook food adequately. Each food has specific minimum internal temperatures. Proper cooking kills harmful pathogens. Temperature abuse is a leading cause of illness. Holding food at incorrect temperatures. Temperature danger zone, 41 degrees Fahrenheit to 135 degrees Fahrenheit. Bacteria grow rapidly in this range. Time and temperature control is critical. Using contaminated equipment. Cross-contamination spreads pathogens. Proper cleaning and sanitizing prevents spread. Equipment must be in good repair. Practicing poor personal hygiene. Humans are the #1 source of contamination. Proper hand washing is the most important prevention. Ill employees must be excluded or restricted. In this section, we'll cover the responsibilities of a certified manager. Active managerial control. This concept is crucial for the exam. It means managers must actively control the 5 risk factors through proactive measures, creating comprehensive food safety policies, training all staff on procedures, monitoring daily operations, taking corrective actions immediately, maintaining detailed records, managers' daily duties, food safety responsibilities, conduct opening and closing inspections, monitor employee health and hygiene, verify proper temperatures throughout the day, ensure proper cleaning and sanitizing, supervise food preparation practices, maintain required documentation. Creating a food safety culture. Elements to remember. Lead by example. Make food safety a core value. Reward safe behaviors. Address unsafe practices immediately. Provide ongoing training. Now it's time to focus on exam preparation essentials. Exam format and structure. Question types. Scenario-based questions, or most common. Direct knowledge questions. Application questions. Critical thinking problems. Topic distribution. Basic food safety, 5%. Personal hygiene, 5%. Purchasing and receiving, 5%. Preparation, cooking and serving, 35%. Facilities and equipment, 10%. Regulatory, 5%. HACP and food safety management, 35%. Test-taking strategies. Proven approaches. Read each question completely. Eliminate obviously wrong answers. Look for key words like most important or first action. Temperature questions are frequent. Memorize all critical temperatures. When in doubt, choose the safest option. Common exam topics. High-frequency areas. Temperature requirements for all food types. Proper hand-washing procedures. FIFO or first in, first out principles. Major foodborne pathogens and their sources. Cleaning versus sanitizing procedures. HACP principles and critical control points. In this foundational lesson, you've learned the essential framework of the ServSafe certification program. Remember these key takeaways. ServSafe is the industry standard for food safety certification, recognized nationwide and based on FDA food code principles. The 5 key risk factors are the foundation of food safety and heavily tested: unsafe sources, inadequate cooking, improper holding, contaminated equipment, and poor personal hygiene. Active managerial control is your primary tool for preventing foodborne illness through proactive policies, training, monitoring, and corrective action. Legal requirements vary by jurisdiction, but all emphasize having certified managers who understand and implement food safety principles. The exam tests practical application of food safety knowledge, not just memorization. Focus on understanding why procedures exist and how to apply them in real situations. Your success on the ServSafe exam depends on understanding these fundamentals and building upon them in subsequent lessons. Food safety is not just about passing an exam, it's about protecting public health and ensuring the success of your food service operation.